Around Australia in a caravan in support for men's health, an initiative to increase awareness of prostate cancer. Joining me live is Pharmacist of the Year for 2022 and founder of Men's Health Downunder, Brad Butt. Thank you so much for joining us. So you're hopping in a caravan and you're heading around the country to raise awareness for men's health. Tell us more.
Yeah, that's right. It's been in the works for a little while, Janie, and just after Easter, we decided it was time to go. So we hopped in the caravan, the wife, the 4 kids, myself, and hit the road, going around Australia to create more awareness around men's health, urological health, so anything that pertains to penis, prostate, incontinence, because we know that the guys in the bush don't get the support that they need.
Well, tell us some statistics on men's health. I know that you are talking about prostate cancer, for example.
Yeah, prostate cancer is one of the big ones. And during COVID, we know that a lot of guys didn't get into their GP to get their regular blood checks done. And prostate cancer affects about 24,000 men annually. That doesn't sound like a lot when you consider the population of Australia, but in fact, it's the largest cancer of males in Australia, and it outranks breast cancer in terms of cases. So this is a really prevalent cancer in men. And we know that guys survive for years afterwards, which means that not only are they left with the scars of prostate cancer, but some of the mental health concerns and incontinence and erectile issues that go with it can be really bothersome for them, and they don't know where to go to get help.
So is it a genetic predisposition for prostate cancer? And tell us more, like the statistics on how many people get it and the symptoms.
Yeah, of course. So, look, I mean, there's some suggestion that it can be inherited. So if your father had prostate cancer, you're certainly more likely to get prostate cancer. So it's a risk factor. Equally, there's some belief that if your mother had breast cancer, there's an increased risk of you having prostate cancer as well. So we don't know enough yet about it to make that link conclusively, but certainly the recommendation is if you've got a history of prostate cancer or breast cancer in your mother or father, you should be getting your PSA, your blood checks done from age 40. For everybody else, it's from age 50. As I said, we know that about 24,000 men annually are diagnosed, and through COVID, less GPs saw patients to refer for PSA blood checks. So we're concerned that there's actually a lot more men out there that have probably possibly got prostate cancer but don't yet know it. In terms of symptoms of prostate cancer, it can be silent, as so many cancers can be, which is a bit frightening. The other things that we tend to get guys to keep an eye out for is getting up at night to go to the toilet multiple times. If you've got a weak flow of urine, so when you're a young fellow, when you go to the toilet, it should be a good, strong flow. If it's getting weak or you're having trouble starting or stopping urination, or when you finish urination, you dribble a bit or it's hard to get going, these sorts of things can be an indication. Interestingly, erectile dysfunction can also be an indication something can be up with the prostate. It may not be cancerous, but it's certainly worth talking to the GP about it so they can double check it, make sure everything's in order and get it fixed up.
Well, you know, as you're doing, you're travelling around the country, you're raising awareness. It's a lot of things that, you know, people don't want to talk about, and, you know, it's easy to just put aside and forget, you know, to get your yearly checkup and so forth. But it really is so important. Tell us, you know, is it painless? Is it the screening? Tell us about that.
Yeah, look, what we know, Janie, is that men typically don't talk about their health as well as women do. And when it comes to urological health, so that's sort of the penis, the prostate, the testicles, continence, these sorts of things, men are even less likely to talk about it. So it's really important that the guys go out and get checked. It's as simple as a blood test. So they used to talk about putting the digital rectal examination where they put the finger up the anus and check the prostate. That typically isn't done by the GPs these days. It's often done by the urologist where there's a bit more of an issue. But the blood test is the best marker or the best check that we've got for prostate cancer. And it's a very simple one. You go in, they check the blood, take a little vial and send it off to pathology and check it. And it probably should be done annually so that we can just keep an eye on it and make sure it's not rising. It's not definitive, but it certainly is a really good indication that we have or haven't got a problem. Doesn't hurt a bit. It's no different to getting your COVID shot done. You can get that done with your pharmacist or your doctor. This is not much different. You have to go to your doctor to get the referral for the blood test, but it hurts no more than getting a COVID shot done, which is great. It's really no trouble to do. And rest assured, if you get onto it early, it's the sort of cancer that guys are surviving really well with. I mean, we've always heard prostate cancer, you don't die from it, you die with it. That's not the case. If we don't get onto it early, it absolutely kills guys. It kills lots of Australian men, and we don't want that to happen. It's needless. We can get the blood test done, get on it early. There's a lot of good treatment options for it that the urologist or the doctor can run through with the patients, and the outcomes tend to be pretty good. I guess the concern is, after you've been diagnosed, how do you hold up mentally? And some of those other problems that we know that guys have in terms of erectile dysfunction and incontinence and their general self-esteem. Those things can be knocked around a lot. And that's where I guess what we're doing, raising awareness and talking to the guys about life after prostate cancer or with prostate cancer, it is actually, you can live a very happy, full life with it.
All right, well, thank you so much and all the best travelling around the country and, to make some good points, painless and keeping, healthy and preventative measures. Very important indeed, Brad, but thank you so much.
Thanks so much.